Well, a warm welcome to this talk. It's Thursday, the 10th of August. Now, I've been working on excess deaths, which remain high for the data that we have for May 2023. But while I was researching that, I came across a really disturbing speech from the Secretary General of the World Health Organization talking about WHO global health certification. Now, bear in mind, they're still working on this power grab, this international health regulations things that governments around the world seem to be sleepwalking into. Now, I'm going to play you a video now. Just look out for where he talks about the value of digital health that was highlighted in the SARS coronavirus pandemic. He talks about developing a digital infrastructure based on the European Union certification system, which was, as I understand it, a very efficient thorough system for monitoring people's vaccination status, for example. Then he talks about a global health certification network. This is going to be a global endeavour. So wherever you go, your digital information will be there and be available. Now, this seems to have started already. They've taken the European Union model and they're sort of building on this now. And this is for global public health and global public good, according to the Director General, former Ethiopian politician and academic. More data is going to be added soon, so more information about you will be on this global health certification network for global good. It's going to be accessible globally. He emphasises that privacy is the key. I'm not going to comment on that. I'm just going to say, would you buy a second-hand car off this guy? He's talking about the next pandemic already. Is there something in mind? Do they know something we don't? Cross-border records are going to be readily available. This is going to be necessary, apparently, because of migration, for example. So health records are going to be available anywhere. Accessible by whom, he doesn't actually point out. Administrative arrangements are being developed, and this is a vital infrastructure. Nowhere does he mention the global scandal of excess deaths. I know this speech is about global health certification, but I can't see it anywhere else either. So I'm going to play you the speech now. Look out for those key points, and it's just a very ominous development of it, as I see this, and countries around the world and populations around the world are just sleepwalking into this form of what some might consider totalitarianism. Watch the clip now.
The COVID-19 pandemic highlighted the value of digital health solutions in facilitating access to health services. While the emergency phase of the COVID-19 pandemic is now over, investments in digital infrastructure remain an important resource for health systems and for economies and societies at large. Like many countries, the European Union made significant investments in COVID-19 certificates to help people move around as safely as possible during the pandemic. The European Union's certification system was used by all 27 EU member states and more than 50 other countries. Building on the success of the EU system, WHO is proud today to launch the Global Digital Health Certification Network. So thank you so much to European Union for the excellent certification system that you have transferred to us, and we have the chance to build on it. WHO will begin operations of the network today with the existing COVID-19 certificate as a global public good. Soon after, we will expand this infrastructure by incorporating other use, such as a digitized international certificate of vaccination, routine immunization cards, and international patient summaries. WHO will continue to work with all regions to ensure that the network is accessible globally, incorporating relevant experiences and standards from other countries and regions. It's important to emphasize that privacy is key. WHO will not have any access to any personal health data. We will only maintain a directory of the public keys that can be used to verify the authenticity of a member state's digital health records. The Global Digital Health Certification Network will be an important part of our efforts to strengthen health systems and support our member states to prepare better for the next epidemic or pandemic. The network could also play a crucial role in cross-border humanitarian situations by ensuring people have access to their health records and credentials as they move across borders due to conflict, the climate crisis, and other emergencies. WHO would like to thank again the European Commission for its partnership and support, and for advocating the EU member states and other participants that they migrate to the WHO network. I also thank the EU and WHO teams who worked hard to bring us to this moment. We very much value the European Commission's technical and financial support, and we very much hope that support will continue. WHO looks forward to implementing this administrative arrangement and furthering our collaboration so that all member states can equitably reap the benefits of this vital digital public infrastructure.
Well, there we have it. I don't think it's a deep fake. So all that alarming material I put out to you at the beginning was not to ruin your day. It's because that is my interpretation of what he said. Governments around the world really need to start taking notice of this. It's really quite an ominous development in my view. But that's just me. Don't let me influence you. Just take his words and work out what they mean for yourself and the implications that they have for you, your family, your area, your country, and our collective futures. Thank you for watching.